What if I told you that the biggest mistake I made for years wasn't eating one unhealthy meal, skipping one workout, or having a bad week?
It was believing that the damage happening inside my arteries was simply a normal part of getting older. For years I thought, well, I'm getting older. My cholesterol isn't perfect, my blood pressure goes up sometimes. That's just life. But here's the part that changed everything for me. Your arteries don't suddenly become unhealthy one morning when you wake up. The process can develop silently for years, and you can feel completely normal while it is happening. That is what makes atherosclerosis so dangerous. Plaque can gradually build inside artery walls, narrowing the space available for blood flow. And sometimes the first obvious warning is not tiredness or a little chest discomfort. It can be something much more serious, such as a heart attack or stroke. So when I started thinking seriously about what 20 years of lifestyle could have done to my cardiovascular system, I stopped asking one question. How do I get rid of plaque quickly? I started asking a much better question. How do I make my body a place where plaque is less likely to grow, become unstable, or cause a problem? That completely changed my approach. And today I'm going to walk you through the 7 things that mattered most. But before we start, let me make something very clear. This is not a miracle plaque cleaning trick. There is no drink, supplement, detox, or 2-week hack that magically scrubs your arteries clean. And if somebody tells you that they've discovered one, be very careful. Real cardiovascular health is much less exciting than a miracle cure, but it is much more powerful. It comes down to what you do repeatedly, day after day, month after month, year after year. And that's exactly where my journey began. Number 1, I stopped thinking about cholesterol as just a number. For a long time, I looked at cholesterol almost like a score on a report card. If it wasn't extremely high, I didn't worry too much. That was a mistake. The important question isn't simply, what is my total cholesterol? You have to understand the entire picture. LDL cholesterol and other atherogenic lipoproteins play an important role in the development of atherosclerotic cardiovascular disease. The newer 2026 American Heart Association guidance emphasizes looking beyond LDL alone in certain situations, including other atherogenic particles and risk factors such as lipoprotein A. Once I understood that, I stopped trying to chase a single laboratory number. Instead, I started looking at my cardiovascular risk as a whole. What was my LDL? What was my blood pressure? What was my blood sugar? What was my weight? Was I physically active? Was I smoking? How much sleep was I getting? How much processed food was I eating? And perhaps most importantly, what was I doing consistently? Because here's something people don't always understand. Your arteries don't care what you intended to do. They respond to your biology. If your body is repeatedly exposed to high levels of atherogenic lipoproteins, high blood pressure, tobacco smoke, uncontrolled blood sugar, inactivity, and other risk factors, the environment becomes more favorable to vascular disease. That's why prevention isn't about one perfect day. It's about changing the environment inside your body. And once I understood that, I stopped looking for shortcuts. I started looking for habits I could actually maintain. Number 2, I made LDL reduction a serious priority. This was probably one of the biggest changes in my thinking. I used to think that eating healthier was mainly about losing weight. But cardiovascular health is bigger than the number on the scale. You can be thin and still have important cardiovascular risk factors. And you can lose weight without necessarily fixing every risk factor that matters. So I became much more deliberate about the foods I was eating. I started reducing foods high in saturated fat and highly processed foods. I paid much more attention to vegetables, fruits, whole grains, legumes, nuts, fish, and other nutrient-dense foods. I wasn't trying to follow some crazy internet diet. I was trying to build a pattern of eating that I could live with. The American Heart Association recommends a heart-healthy dietary pattern, emphasizing vegetables, fruits, legumes, nuts, whole grains, fish, and healthy protein sources while limiting refined carbohydrates, sugar-sweetened beverages, processed meats, and trans fats. And there was an important realization here. Healthy eating isn't about finding one magical food. It's about what happens when hundreds of small food choices start moving in the same direction. Think about it. One salad doesn't clean your arteries. One hamburger doesn't destroy them either. The problem is the pattern. If your normal diet is built around highly processed foods, excessive saturated fat, refined carbohydrates, sugary drinks, and too many calories, then changing one meal isn't going to transform your cardiovascular risk. But if your normal diet gradually becomes healthier, that's different. Now you're changing the environment your body lives in every day. And that's what I wanted. Not a temporary diet, a permanent change. Number 3, I started moving every day. This sounds almost too simple, but it may have been one of the most important changes I made. I stopped thinking about exercise as something I had to do only when I had enough time. Because let's be honest, if exercise requires perfect circumstances, most people won't exercise consistently. There will always be another meeting, another responsibility, another excuse. So I changed the goal. Instead of thinking, I need to have an amazing workout, I started thinking, I need to move. Walking, climbing stairs, resistance training, aerobic exercise, whatever I could realistically maintain. The American Heart Association recommends at least 150 minutes per week of moderate intensity activity or 75 minutes of vigorous activity for most adults, alongside reducing sedentary time. Professional.heart.org, and I discovered something interesting. The hardest part wasn't the exercise. It was creating the habit. Once movement became normal, it stopped feeling like punishment. It became part of my day. And that matters because exercise isn't just about burning calories. Regular physical activity supports cardiovascular fitness, blood pressure, metabolic health, weight management, and overall cardiovascular risk reduction. It also changes the way you feel. You start sleeping differently. You start having more energy. You become more comfortable moving your body. And suddenly you aren't exercising because you're trying to punish yourself for what you ate. You're exercising because you want your body to work better. That's a completely different mindset. Number 4, I took blood pressure seriously. This one surprised me. People often focus so much on cholesterol that they forget another major factor affecting the arteries. Blood pressure. Imagine water continuously flowing through a pipe under excessive pressure. Now imagine that happening inside your body for years. Your arteries aren't just passive tubes. They are living tissues. High blood pressure can damage artery walls and increase cardiovascular risk. That's why controlling blood pressure is such an important part of preventing and managing atherosclerotic disease. So I stopped thinking, my blood pressure is only high when I'm stressed. I started looking at the pattern. Was it consistently elevated? Was I getting enough sleep? Was I eating too much sodium? Was I physically inactive? Was my weight contributing? Was stress constantly pushing everything higher? And if medication was medically indicated, I wouldn't treat that as a personal failure. That's another mistake people make. Some people believe taking medication means they've failed at lifestyle. No, if you need medication, the goal is to reduce your risk. It's not a competition to see who can avoid treatment. Lifestyle matters. Medication can matter. And sometimes the smartest approach is both. Number 5, I stopped treating smoking as a small risk. If you smoke, this section matters. And if you don't smoke, understand how lucky you are. Smoking is one of the most damaging things you can do to your cardiovascular system. It damages blood vessels and significantly increases cardiovascular risk. Quitting is one of the most important things a smoker can do to reduce that risk. For me, this was less about finding another supplement and more about removing something harmful. That distinction is important. Sometimes improving your health isn't about adding something. It's about removing the thing that's causing damage. You don't need another powder. You need to stop the exposure. You don't need another complicated routine. You need to remove the habit that's working against you. And that's one of the biggest lessons I learned. When it comes to cardiovascular health, subtraction can be just as powerful as addition. Less tobacco, less processed food, less sitting, less excess alcohol, less unnecessary stress, less of the things that repeatedly push your cardiovascular system in the wrong direction. Number 6, I became serious about blood sugar. This is another area people often overlook. You don't have to wait until somebody tells you that you have diabetes before you care about blood sugar. Your metabolic health matters long before a diagnosis. High blood glucose over time is associated with increased cardiovascular risk. And diabetes is an important risk factor for atherosclerotic cardiovascular disease. So I started paying more attention to what happened after I ate. Was I constantly eating? Was I drinking sugary beverages? Was most of my food highly refined? Was I gaining abdominal weight? Was I sleeping badly? Was I moving enough? Again, I wasn't trying to completely eliminate every carbohydrate. That is where online health advice often goes off the rails. Carbohydrates are not automatically the enemy. The quality, quantity, overall dietary pattern, and individual metabolic situation matter. Whole grains, vegetables, legumes, fruits, and minimally processed carbohydrate sources can fit into a heart-healthy diet. The bigger issue is when your diet becomes dominated by refined carbohydrates, sugary drinks, ultra-processed foods, and excess calories. So instead of asking, what food can I never eat again? I started asking, what foods should make up most of my diet? That's a much healthier question. Number 7, I changed my relationship with stress. This is the one I underestimated the most. I used to think stress was just something psychological, something happening in your head. But chronic stress can affect sleep, blood pressure, eating behavior, physical activity, and other factors that influence cardiovascular health. And when you're stressed, what happens? You sleep less, you move less, you eat differently, you may drink more, you may smoke more, and suddenly one psychological problem starts creating 5 physical problems. That's why stress management became part of my cardiovascular strategy. Not because meditation magically dissolves plaque. It doesn't, but because reducing chronic stress can help you maintain the behaviors that protect your cardiovascular system. I started giving myself time to slow down. I became more protective of my sleep. I spent more time walking. I tried breathing exercises. I made space for family. And I stopped treating exhaustion like a badge of honor. Because being constantly exhausted isn't a sign that you're winning. Sometimes it's a sign that your system needs recovery. But here's the part most people get wrong. Now let me tell you something extremely important. When people hear a story like this, they immediately want the shortcut. They ask, what did you take? What did you drink? What supplement did you use? What food cleaned the plaque? And I understand why. We all want a simple answer. But arteries don't work like a dirty kitchen pipe. You don't drink something and have cholesterol plaque slide out of your arteries the next morning. Atherosclerosis is a complex biological process involving lipoproteins, inflammation, vascular injury, and other factors. And treatment is not one size fits all. Lifestyle changes can prevent or slow atherosclerosis. And cholesterol-lowering medicines can reduce plaque buildup. Some therapies can produce plaque regression in appropriate patients. That means the goal isn't necessarily make every bit of plaque disappear. The goal is reduce cardiovascular risk and make existing disease less dangerous. That's a much more realistic way to think about it. So did the plaque actually disappear? This is where I want to be extremely honest. If you have had arterial plaque for 20 years, you cannot simply look in the mirror and know whether it's gone. Feeling better doesn't prove that plaque disappeared. Having more energy doesn't prove your arteries are clear. Losing 20 pounds doesn't prove that either. Even a dramatically improved cholesterol level doesn't automatically mean every plaque deposit has vanished. If you want to know what is actually happening inside your arteries, you need appropriate medical evaluation. Depending on the situation, that might include blood tests, blood pressure measurements, risk assessment, and sometimes imaging, such as coronary artery calcium scoring or other cardiovascular imaging. The 2026 AHA dyslipidemia guidelines specifically include selective use of coronary artery calcium testing to help refine cardiovascular risk in appropriate people. That's why I would never tell someone, do these 7 things and your arteries will be completely clean. That would be irresponsible. What I can say is that the evidence strongly supports reducing the factors that drive cardiovascular disease. And in some people, intensive treatment can stabilize or even reduce atherosclerotic plaque burden. That's very different from claiming that a 20-year-old plaque deposit has been magically washed away. Let's talk about something that people often get wrong. Statins. Some people hear the word and immediately say, I don't want medication, I'll just eat better. Others say, I'll take the pill so I don't have to change anything else. Both approaches can be problematic. Statins are an important evidence-based treatment for many people with elevated cardiovascular risk. And guidelines continue to recommend them as first-line LDL-lowering therapy in appropriate patients. But medication doesn't give you permission to ignore lifestyle. And lifestyle doesn't automatically mean medication is unnecessary. The right decision depends on your risk, your age, your LDL, your blood pressure, whether you have diabetes, whether you've already had cardiovascular disease, your family history, your other risk factors, and sometimes additional testing. That's why I don't tell people online, stop your statin, or everyone needs a statin. Medicine doesn't work that way. You discuss your individual risk with your healthcare professional. If you are already taking a cholesterol-lowering medication, don't stop it because you watched a YouTube video. That's not how responsible medicine works. What about supplements? This is where the internet gets really interesting. Search for clean arteries and you'll find dozens of products. Garlic, fish oil, herbal mixtures, detox drinks, special teas, powders, capsules, and promises that sound almost too good to be true. Usually they are. Some foods and supplements can influence certain cardiovascular risk factors, but that doesn't mean they can remove established arterial plaque. The American Heart Association specifically advises discussing supplements with a healthcare professional and does not recommend relying on supplements as a substitute for guideline-based cardiovascular treatment. So here's my rule. If somebody promises to flush plaque out of your arteries, ask them for the evidence, not testimonials, not before and after pictures, not a celebrity endorsement. Evidence, randomized clinical trials, clinical guidelines, actual cardiovascular outcomes. Because preventing a heart attack is not the same thing as making a laboratory number look better. That's an incredibly important distinction. The biggest change wasn't my diet. If I had to choose one thing that changed everything, it wouldn't be a particular food. It would be consistency. That's the part nobody wants to hear. People want transformation in 30 days. But your arteries have been exposed to your lifestyle for years. You can't realistically expect decades of risk factors to disappear because you had a perfect January. Think about brushing your teeth. You don't brush once for 5 hours and say, "Done, I don't have to brush again for 6 months." It doesn't work. Your cardiovascular system is similar. The protection comes from repeated behavior. You eat well today. You move today. You don't smoke today. You control your blood pressure today. You take prescribed medication today. You sleep tonight, then you repeat it tomorrow. And again, and again. That's what makes the difference. What I eat now, my approach became much simpler. Instead of asking what diet was trending, I started building meals around foods that were naturally nutrient-dense. Vegetables, fruits, legumes, whole grains, nuts, fish, healthy sources of protein, and foods that weren't heavily processed. I reduced the foods that were easy to overeat. I reduced sugary drinks. I paid attention to saturated fat. I became much more conscious of portion sizes. And I stopped trying to be perfect. Because perfection is difficult to maintain, consistency is much easier. If I occasionally eat something less healthy, I don't declare the entire week ruined. I simply return to my normal pattern at the next meal. That's another psychological trick that made a huge difference. One unhealthy meal is not failure. Giving up completely because of one unhealthy meal is the real problem. The weight loss wasn't the whole story. If you're carrying excess weight, losing weight can improve several cardiovascular risk factors. But I don't want you to make the mistake of thinking the scale is the only thing that matters. Imagine two people. Person A loses 10 kilograms but continues smoking, has uncontrolled blood pressure, and has a very high LDL. Person B loses only 5 kilograms but stops smoking, improves LDL dramatically, becomes physically active, and gets blood pressure under control. Which person has made the bigger cardiovascular change? You can't answer that from the scale alone. That's why I started tracking more than weight. I looked at blood pressure, cholesterol, blood sugar, waist circumference, fitness, sleep, and most importantly, whether I could actually maintain the changes. Because the goal isn't to look healthy for a month. The goal is to reduce the probability of a cardiovascular event over the years ahead. I also stopped sitting so much. This sounds almost ridiculous, but modern life makes sitting incredibly easy. You wake up, sit in the car, sit at work, sit during lunch, sit at home, sit while watching television, then go to bed, and the next day, repeat. So I started looking for opportunities to break that pattern. Walk while talking on the phone, stand up regularly, take the stairs when practical, walk after meals, park farther away, move during breaks. These things may seem insignificant individually, but they add up, and they make movement feel normal instead of something you have to schedule as a major event. Sleep became part of my heart's strategy. I used to treat sleep like leftover time. Whatever time remained after work, responsibilities and entertainment was the time I'd sleep. That had to change. Sleep is not wasted time. Your body needs recovery, and poor sleep is associated with cardiovascular and metabolic health problems. Healthy adults are generally advised to aim for around 7 to 9 hours of sleep each night. So I started protecting my sleep. A regular bedtime, less screen time before bed, less caffeine late in the day, a darker room, and when necessary, actually addressing problems that were interfering with sleep. Because if you don't recover, it's harder to maintain everything else. You don't want to exercise. You're more likely to reach for convenient food. Your mood suffers. Your concentration suffers. And suddenly the entire lifestyle system starts falling apart. The 80-20 mindset. Here's another thing that helped me. I stopped believing that I had to live like a monk. That's not realistic. If your diet is healthy most of the time, your activity is consistent, you don't smoke, your blood pressure and lipids are appropriately managed, and you maintain a healthy weight, occasional indulgences don't have to become a crisis. The goal is the pattern, not perfection. But be careful with the 80-20 idea. Don't use it as an excuse to make 80% of your diet unhealthy. The point is simply that sustainable habits are more valuable. What I wish I had known 20 years earlier. This is probably the most important part of the entire story. I wish somebody had told me that cardiovascular disease can develop silently. I wish I had understood earlier that feeling fine doesn't necessarily mean everything inside the body is fine. I wish I had taken blood pressure seriously sooner. I wish I had understood the importance of LDL and overall cardiovascular risk. I wish I had moved more. I wish I had slept better. I wish I had paid more attention to what I was eating. And I definitely wish I had understood that prevention isn't something you start after a heart attack. Prevention starts before the event. That's why I'm talking about this now. Not to scare you, to wake you up, because if you're watching this while you're still relatively young and healthy, that's actually good news. You have an opportunity. You can start today. Don't wait for symptoms. One of the most dangerous things about cardiovascular disease is that you can feel completely normal. That's why regular medical care matters. If you have risk factors such as high cholesterol, high blood pressure, diabetes, smoking history, obesity, kidney disease, or a strong family history of premature cardiovascular disease, don't simply assume you're fine because you feel fine. Talk with a healthcare professional. Get the appropriate tests. Understand your risk. And make a plan. The 2026 AHA guideline emphasizes earlier identification and treatment of lipid-related risk, including appropriate assessment of LDL and other atherogenic factors. The earlier you identify a problem, the more opportunity you have to change the trajectory. And here's what I don't want you to do. Don't wake up tomorrow and decide, I'm going to eat nothing but vegetables, exercise for 3 hours, take 12 supplements, and never eat dessert again. You'll probably last 5 days, maybe 10, and then you'll burn out. Instead, pick the highest impact changes. If you smoke, work on quitting. If your LDL is high, address it. If your blood pressure is high, address it. If you have diabetes or elevated blood sugar, address it. If you're inactive, start moving. If your diet is heavily processed, improve it gradually. If you're overweight, work toward a sustainable weight. If you sleep 5 hours, start protecting your sleep. And if you have known cardiovascular disease, work with your medical team. That is the boring answer, and it's also the answer most likely to help. The arteries are not a kitchen pipe. I want you to remember this analogy. Your arteries are living tissue. They're not plumbing. Plaque isn't simply grease stuck inside a pipe waiting for someone to pour a cleaner through it. Atherosclerosis is a biological disease process. The plaque can contain cholesterol, inflammatory cells, connective tissue, calcium, and other components. And the dangerous part isn't always simply how much plaque exists. Plaque stability matters too. Atherosclerotic plaque can rupture and trigger a blood clot, potentially blocking blood flow and causing a heart attack or stroke. That's why stabilizing disease and reducing cardiovascular risk are so important. You don't necessarily need to chase the fantasy of perfectly clean arteries. You need arteries that are less likely to cause a catastrophic event. That's a much more meaningful goal. So what would I do if I were starting again? If I had to start from zero today, I would keep it incredibly simple. First, I'd get my baseline numbers. Blood pressure, lipid profile, blood glucose or HbA1c when appropriate, weight and waist circumference, and I'd discuss my overall cardiovascular risk with a healthcare professional. Second, I'd look honestly at my lifestyle. Do I smoke? How much do I move? What is my normal diet? How much processed food do I eat? How much alcohol do I consume? How much do I sleep? How stressed am I? Third, I'd tackle the biggest problems first. Not 10 things at once. The biggest problems. If LDL is significantly elevated, address it. If blood pressure is uncontrolled, address it. If I'm smoking, quit. If I'm inactive, move. If I'm eating poorly, improve the food pattern. If I'm overweight, work towards sustainable weight loss. Fourth, I'd follow the numbers. Not obsessively, but consistently, because you can't manage what you never measure. And finally, I'd give it time. Real cardiovascular improvement isn't a social media challenge. It's a long game. The most powerful artery cleaner is prevention. The phrase "clean your arteries" sounds attractive because it creates a simple picture. Dirty arteries, clean arteries. But medicine isn't that simple. The real goal is to reduce the conditions that allow atherosclerosis to progress. Lower the exposure to atherogenic lipoproteins. Control blood pressure. Control blood sugar. Don't smoke. Move regularly. Eat a heart-healthy diet. Maintain a healthy weight. Sleep well. Manage stress. And use evidence-based medication when your risk profile calls for it. That's what protecting your arteries actually looks like. And if you're already worried about plaque, don't panic. Finding plaque doesn't automatically mean a heart attack is coming. It means you have information, and information can be powerful. If a scan shows coronary calcium, for example, that doesn't mean you should immediately start taking random supplements or attempt a dangerous extreme diet. It means you should understand what the result means for your overall cardiovascular risk. Then make a plan. Depending on the individual situation, clinicians may recommend lifestyle treatment, cholesterol-lowering medication, blood pressure treatment, diabetes management, smoking cessation, or additional testing. The goal is not fear. The goal is action. The change I felt first. You might expect me to say that the first thing I noticed was that my arteries became clean. I couldn't feel that, and neither can you. What I could feel were the changes happening in everyday life. I had more confidence in my routine. I felt better after being physically active. I became more conscious about food. I slept with more intention. I became more aware of my blood pressure and laboratory results. And most importantly, I stopped treating my health like something I could deal with later. That was the real transformation. The biggest change wasn't necessarily something I could see. It was the way I started thinking about my future. 20 years of damage doesn't need 20 more. Maybe you've been eating badly for 20 years. Maybe you've been inactive for 20 years. Maybe your cholesterol has been high for years. Maybe you smoked. Maybe you've gained weight. Maybe your blood pressure has slowly climbed. And now you're thinking, I've already messed everything up. What's the point? Please don't think that way. You can't change the previous 20 years, but you can influence what happens during the next 20. That's the part you control. And even if you already have cardiovascular disease, treatment isn't hopeless. Atherosclerosis can be treated, and lifestyle changes can help prevent or slow progression. Appropriate cholesterol-lowering therapy can also reduce plaque buildup and, in some circumstances, contribute to regression. So don't let the past become an excuse for repeating it. One last warning: if you have chest pressure, chest pain, unusual shortness of breath, sudden weakness, difficulty speaking, facial drooping, or other symptoms that could represent a heart attack or stroke, don't sit at home trying to clean your arteries naturally. That's an emergency. A blocked coronary artery can cause a heart attack, and atherosclerotic plaque can contribute to stroke when blood flow is interrupted. You need urgent medical attention. This video is about prevention and long-term health. It is not a substitute for emergency care. So did I really clean 20 years of plaque overnight? No, and that's not the lesson. The lesson is much more powerful. I stopped giving my body the conditions that were pushing my cardiovascular system in the wrong direction. I started taking LDL seriously. I started moving. I became serious about blood pressure. I paid attention to blood sugar. I improved my diet. I protected my sleep. I worked on stress. And I stopped looking for a magic pill. The goal wasn't perfection. The goal was progression. One better meal, One walk, one workout, one night of better sleep, one blood pressure reading that improved, one laboratory result moving in the right direction, one habit repeated until it became normal. That's how you change your health. Not in one dramatic moment, but through thousands of small decisions that eventually become your lifestyle. And maybe that's the message you need to hear today. You don't need to fix the last 20 years today. You just need to stop adding another unhealthy year to them. Start with one thing, then another. Get your numbers checked. Know your cardiovascular risk. Talk to your doctor. And if you have known plaque or cardiovascular disease, don't rely on social media claims to decide your treatment. Evidence-based care matters, because your arteries are working for you every second of every day. You don't feel them, you don't see them, but they are delivering oxygen to your brain, your heart, your kidneys, your muscles, and every other part of your body. Take care of them, not for a week, not for a viral challenge, not because somebody promised to flush the plaque. Do it because you want to be here, healthy and active years from now. That's the real goal. And if you've spent the last 20 years making choices that weren't great for your heart, don't waste another 20 years feeling guilty about them. You can't rewrite the past, but you can absolutely start writing the next chapter. Start today. Protect your heart, protect your arteries, and make your future self grateful that you did.